Before we get started on remedies, it's important to understand some of the causes of bedwetting. I found that the habit of bedwetting usually goes back to events at age 2, 3, or 4, when the child has to go to bed happy in mind and happy in body in order to sleep comfortably enough to learn the vasopressin trick. In this video, we'll look at some of the causes of bedwetting and how to fix them. There may be 2 or 3 causes present, so we use a shotgun approach to remedies, several remedies at the same time, to be sure of a quick and happy fix. When a child wets the bed at night but not during the day, we know that either the bladder signal isn't strong enough or the sleep is too deep to feel it. So first, let's check for any medical problems. The more serious complications, quite rare, are diabetes and infection. Generally, if a child wets at night but not during the day, physical issues are quite unlikely. Has there been a recent loss of weight? Is the child frequently thirsty, especially at night? Is there any pain in the tummy or during urination? Does he have an elevated temperature? If the answer to any of these is yes, you should probably see a doctor. Doctors will often say he has a small bladder, and they might suggest ultrasound or measuring urine output to determine the bladder size. It's more common, however, that the bladder is just too thick, and this can be fixed with proper hydration and toileting. Here's a normal bladder compared to a small bladder. The bladder is a round muscle, and when urine is held in, the sphincter or holding muscle is fighting the bladder muscle. This exercise causes both muscles to get too strong and thick. The bladder is less elastic, it holds less, and it sends a weaker signal. The treatment is to use it properly. Fill it up, empty it out, fill it up, empty it out, and never, never hold. Many children are messed up because everyone says that they shouldn't have fluids in the evening, but the opposite is true. If you don't have enough water in your system during the night, you may become constipated, have a headache, and feel tired during the day. And why is that? Well, your kidneys have an important job to do. They look after your blood to take care of your heart and brain. They need water. And if you don't have water in your tummy at night, they seem to suck it from your bowels, so you'll end up constipated. The remedy is simple. The rule is mushy poop in the morning. If you're properly hydrated, then your stool will be mushy and you'll be having a bowel movement at least once a day, commonly in the morning. If your child doesn't have a daily bowel movement or has any unusual movement, watery, hard, or pebbly stool, then constipation is present. See more about this on the Bristol chart. Holding the bladder can be the result of holding the bowel or by a distended bowel due to constipation. Dr. Shauna Reagan discovered many years ago that a majority of bedwetters have undiagnosed constipation. They may have normal bowel movements. Their family doctor sees no evidence of constipation and no signs of it are apparent. But when x-rayed, he found that 25 of 30 bedwetters had a buildup of stool enough to push on the bladder, causing day and night wetting and troubled sleep. Fortunately, the cure is simple and harmless. A daily dose of Restoralax and regular water gulping. Restoralax, containing PEG 3350, is not a laxative, it's not a chemical. It's just tiny plastic sponge-like powder that absorbs water and carries it to the bowels to soften your stool. See the CPA link for more information on treatment of constipation. Certain foods can cause problems with sleep. Milk is a common issue. Some children are allergic to milk, others are just sensitive to it, and it has a role in constipation. So we recommend that milk and milk products, especially ice cream, be avoided in the 2 hours before going to bed. You'll also want to avoid grapes, citrus, melons, strawberries, which are common anuretics, in that 2 hours before bed. Water is a medicine that fixes bedwetting. It fixes constipation, it tones the bladder, it removes toxins like food colors. To get the bladder and bowel back into best condition, go to the bathroom every 2 or 3 hours, then gulp water, and have that last water an hour before bed, with one exception. When you're using a bedwetting alarm, that last water should be just before going to sleep for the first 2 or 3 weeks and then revert to an hour earlier. So, to sum up, look for medical complications, including diabetes and infection. Cut out extra sugar, melon, citrus, and milk in the evening. Gulp water often. Use the toilet often.
Created using Powtoon.